Welcome to International Medical Corps' briefing to mark the 1 year since the start of the current war in Ukraine. I'm Rebecca Milner, International Medical Corps' Chief Advancement Officer. We're so glad you've joined us today. There's a lot going on in the world right now, and as you may know, International Medical Corps is responding to the devastating earthquakes in Turkey and Syria. The ongoing aftershocks and the fact that the destruction is over such a wide geography, over 2 countries, makes this a challenging response. However, we've mobilized our teams and delivered more than 15 tons of medicines and supplies to health facilities, launched mobile medical teams, and begun delivering essential supplies for families. We continue to ramp up our efforts, and we'll arrange a more in-depth briefing in the coming weeks. In the meantime, you can follow our response on our website and social media. Many of you joining us today have supported our work over the years, and in particular, our emergency response efforts. We're incredibly grateful for your trust and commitment, and we can't do our work without you, so thank you. We're going to keep today's briefing as efficient as possible. We'll wrap up in about 45 minutes. Toward the end of our conversation, we'll take questions. So as we talk, please feel free to type in your questions into the Q&A box at the bottom of the Zoom window there, and we'll do our best to get to them. As everyone knows, International Medical Corps was working in Ukraine prior to the invasion, and we immediately began expanding our work once the war started. Over the past 12 months, we've reached some 6 million people. Our work spans 11 oblasts or states across Ukraine, and we're working on many fronts, providing desperately needed medicines, supplies, and equipment to hospitals and health facilities, providing direct health and mental health services, conducting training for health workers, rehabilitating facilities and water infrastructure, delivering essential supplies and cash assistance, and more. We're really lucky today to hear from 3 of our colleagues in Ukraine who will share more about conditions on the ground, what this past year has looked like, and talk about the upcoming challenges for 2023. I'll start by introducing our colleague, Matthew Stearns. Matthew's our country director in Ukraine. Previously, he served as country director in Afghanistan, and prior to that, led our operations in South Sudan. So Matthew is no stranger to challenging operating environments. He has worked for more than a decade in the humanitarian relief sector in various countries. Welcome, Matthew. And we also have Dr. Michelle Engels joining us. Michelle is a mental health and psychosocial support technical advisor and our deputy country director in Ukraine. Michelle started her career 20 years ago working in community mental health care in Australia. And for the past 10 years, Michelle has specialized in mental health and psychosupport in humanitarian settings. And then we also have Natalia. Natalia Rudyka is a program officer currently based in Kharkiv. Natalia joined International Medical Corps soon after the invasion and has worked extensively throughout the north and northeast of the country, helping set up programs as we are able to access newly liberated areas. She has a unique perspective into the needs of her fellow Ukrainians and the challenges of ensuring continuity of healthcare in the country. Welcome to you all, and as always, thank you so much for the work you do. So let's dive right in and start with you, Matthew. Can you give us an overview of what conditions look like now on the ground?
Sure. Thanks so much, Rebecca. I'm going to take just a second to acknowledge the generosity of the crowd that's attending this right now. I can proudly attest to the fact that the IMC team on the ground here in Ukraine tries to do right by that generosity every single day, and we're so grateful for their help. In terms of the texture of life on the ground now in Ukraine, the escalation in the conflict after 8 years of what was a relatively small-scale conflict in Ukraine, between Ukraine and Russia, dramatically escalated, of course, in 2022, and has taken now, over the course of recent months, effectively 2 sort of shapes, right? There's 2 layers to this conflict now. You have the ground artillery-based warfare that's happening along the entire eastern front of the country bordering Russia. And this has resulted in incredible loss of life and devastation along that whole eastern front of the conflict. And at the same time, you have a strike campaign, which includes ballistic missiles, drone munitions, this type of aggression, targeting critical infrastructure across the country, and meant to sort of cause disruptions in daily life relative to electricity supply, water supply, heating supply, and these types of elements. So you have this two-tier conflict, this two-tier of aggression that's going on, resulting in enormous population displacement due to heavily localized aggression along the Eastern Front. Members of affected populations being either left behind or forced out of their local areas, and incredible disruptions that we all experience here in Ukraine, Ukrainian nationals and expatriate humanitarian workers alike, disruptions to basic essential services in daily life, like I said, power, water, and heating. This all adds up to a large-scale humanitarian crisis. The latest figures that we're seeing coming out of the UN, there are 17.6 million people currently in Ukraine in need of humanitarian assistance. That is just about 50% of the entire remaining population of Ukrainian nationals here. So incredible need. A lot of people affected by this conflict. The other element that we're facing now as humanitarian actors, as that frontline area is increasingly more embattled, access difficulties for humanitarian service providers as a result of direct attacks on humanitarian workers and general access restrictions just based on the hyper-aggressive security posture in that area. So incredibly difficult working environment. All of that being said, what IMC, is doing here, despite these circumstances, the IMC team, our Ukrainian nationals and our expatriates alike, are pushing forward with our humanitarian mandate. We continue to deliver services in all these key areas where we work every single day, and we won't stop. We try to keep our staff very safe. We have a lot of sophisticated, heavy protocols in terms of keeping our humanitarians safe, but our commitment is to stay here and serve the populations that are in critical needs as a result of this conflict.
And how many people do we have as part of our team in Ukraine?
We're at 400 plus right now.
400 plus, and across the country, right?
It's
right.
Countrywide.
Right. And so, as we look forward, to the next few months, and you mentioned the escalating conflict. What are some of International Medical Corps' priorities? How are we going to move forward in 2023?
So what we're doing now is consolidating our efforts since the onset of the crisis in terms of service provision, targeting the most at-risk populations, right? These population movements and the folks that are left behind and struggling in these areas. We're here to serve anyone in need, right? But we do prioritize the most vulnerable members of these populations: elderly folks, people with disabilities, moms with kids, under fives, young children, right? So we're targeting them, and we've got 5 different thematics, programmatic service areas where that we concentrate on. Healthcare. The healthcare infrastructure around the country is absolutely devastated. We are concentrating heavily on trying to provide support along those lines. Clinical and social support through our mental health and gender-based violence interventions. Water and sanitation efforts. Access to clean water is very challenging for some of these populations that are on the move or stuck in areas that are devastated. Also nutrition support for at-risk kids and moms who may have some challenges with nutrition relative to some of these displacements and disruptions. And then we also have a direct cash assistance program that we're running here. And direct cash assistance is oftentimes a preferred mode of assistance in a context like this. So we have a pretty hardy cash assistance programming element as well.
Right. My understanding is that we've delivered $3.5 million of cash to more than 13,000 people so far.
That's right. And that is a very effective way of programming here and supporting people. So yes.
Yeah. Well, let's turn to you, Michelle. I mean, in some ways, it's kind of hard to believe that it's already been a year. On the other hand, I think we know that each day in Ukraine can feel really long and hard. And with your focus on mental health, what are you seeing in terms of the impact of this conflict? I mean, maybe you could speak to both in terms of the impact on our staff as well as on the community members.
Yeah, absolutely. I mean, it's hard to believe actually that it's been a year. And like you said, the impact has really just been immense, on both staff, but also on the general community. If we look at our staff in particular, they've had to get used to very different ways of working, just speaking about our mental health teams, for example, we have psychologists who used to be working in private practice where you have maybe an office and people come to see you very regularly. And now we're talking about a whole different setting, thinking about areas close to the front line like Kharkiv. We have mobile teams go out. So it's a very different operating environment. We're not able to do the types of interventions that we normally would. That definitely has pushed staff outside of their comfort zone. It has meant that we've needed to focus a lot on training and supervision of staff as well. And as Matthew highlighted, really at all times, the safety of staff is our priority. And attached to that is this concept of psychological safety as well. So we have a component that really cares for our staff and allows them to have access to mental health support if it's needed, because we know that they themselves are often members of the affected community. When we look at the community members more broadly, it really is a different picture depending on where we're talking about in Ukraine. And the needs are huge. It's just that they can look a little bit different. So in the West, there is still shelling, I'm not meaning to say that it's safe, but there is a greater sense of safety than what it is in the east of the country. And that means that in some ways it gives community members more of a chance to start to process some of the things that they've experienced. And also navigating the uncertainty of the current situation because we don't really know what the future holds. So that presents a very different challenge to in the East, for example, where it's highly volatile. There's regular shellings. The levels of distress are extremely high. And it's a very volatile situation that requires a completely different way of operating. So I think it's really remarkable how flexible our teams have been to work with such unique situations.
Well, in such an overwhelming environment, I mean, I think some people say, well, how can you provide mental health support, and what does that look like? Talk a little bit about the case management approach and how we try to reknit that social safety net.
Yeah, absolutely. So, in the East, it looks a little bit different because we may not necessarily have continued access to certain areas. So our intervention there is kind of more brief and emotionally supportive and really focused on stress management. And wherever possible, we really give community members themselves the skills that they need to support themselves and also to support their fellow community members. That model is so important to really empower the community. In the West and in the central part of Ukraine, we can really start to do this case management approach where we follow alongside one individual over time and we look comprehensively at what needs that they have. So it includes, of course, mental health needs, but also health needs more broadly, whether it's nutrition needs, access to cash. So we make sure that the individual is connected to as many supportive services as possible. Then, of course, we offer psychological assistance for people who require more specialized intervention as well. But it's really important. One of the core pillars of our approach here in Ukraine is to really strengthen the capacities within country as much as possible. So we have done a lot of trainings targeting Ukrainian professionals, but also non-professionals, so that they're better able to support their fellow community.
Mm-hmm. Well, just wanted to encourage our listeners to pose any questions in the Q&A box. And now we'll turn to you, Natalia. This last year must have been especially challenging for you. I mean, not only have you been on the front lines of International Medical Corps work, going to newly liberated areas and helping our teams assess conditions and needs, and then figuring out how best to respond, but this is happening in your country to your people. I mean, share a little bit about, with our listeners about, your experience and what brought you to International Medical Corps.
I think that every Ukrainian remember the day when everything started. We woke up of the sound of the explosions in our cities. And then everything was like in a nightmare. People were running, they were leaving their houses, their relatives. So same happened to me because my boyfriend left to the front line. My relatives and friends, they moved to the West or even left the country. Some of my relatives were left in the territories that were occupied. So they were under occupation during the 6 months. Fortunately, now I'm able to reach out to them, to talk to them, and they're fine. And, I stayed in Kyiv in my apartment, absolutely alone, without any understanding what should I do with my life. I see no future in front of me because every day you can die. And then I started to have this panic attack because every night you expect that something really bad can happen. And I couldn't sleep. I was paralyzed by fear. And actually, I didn't know what to do. And then I remember it was 2nd month of war when my friends sent me the information about the International Medical Corps mission. So I decided that I have to act. I have to do something with my life. And I applied and then joined the team. And we started to travel through all these recently liberated areas. And what I saw there was, it was horrible. I've never seen so much pain, a destruction in my life. And we started to help people, to talk to them. And then I've noticed that they're in much worse situation than I am. And I realized that I have to be strong to be able to provide help for them. And this was kind of the therapy for me, because you asked Michelle and she says, what helps Ukrainian staff? This is what helped me to deal with my depression and panic attack. I was busy. I was helping people. I met really wonderful people. And this International Medical Corps team, they also help people only by their presence. We have in our team, we have people that came from the different countries from all over the world. And every time they come to a city or small village, people see that people from all the whole world are here and they come here to support. This gives us a feeling of safety and understanding that the world is standing with us. We're not alone. People helping us, we're not abandoned, and this inspires us to move on, to do something with our lives and to rebuild our country. So I think that IMC is not a job for me. This is kind of the therapy.
Well, before the call started, we were talking a little bit about your days. I mean, talk a little bit about what happened today.
Yeah, we woke up this morning from the 5 missiles. They landed in the city center. So I'm lucky enough to be able to talk to you right now. Yeah, the situation is not as bad. We already get used to that because in Kharkiv, Kharkiv is located in the eastern Ukraine, and it's under constant shelling. It's can be twice a day or every day. Sometimes we have a break, but people already get used to this, and they're coming back to their homes already because a situation with this electricity and water supply has stabilized recently. So we are fine, relatively fine here, as much as it can be fine in these circumstances.
Well, Matthew was talking about the health services support that we offer, and I know that we've been particularly active in Kharkiv. I mean, maybe you could talk about some of the projects, that we've been doing in Kharkiv.
Oh, yeah, in Kharkiv, like this area, the Kharkiv region was one of the biggest areas that were recently liberated. And we started in the Kharkiv city, but then we expanded to the whole region. And, the needs there is enormous. We have the villages that are completely destroyed. Like there is no single building standing in there, and people still live there. They have no other option. They have no place to go. They have no money. They're desperate. They don't want to leave their houses, even if it's destroyed already. So we are like doing a lot for them and for the healthcare facilities there in Kharkiv, both in Kharkiv and the region. And there are, so many stories that prove the resilience of these people, and this is really inspire us to move on. And for example, I remember this story from the city perinatal center. Perinatal center is the hospital that deals with the newborns that have really severe conditions. And I was there during the first massive attack on the energy and the infrastructure. So I was sitting in the room in the room with the director of the hospital. Then suddenly we heard a couple of explosions outside. Then we've heard that the people started to move on to the shelter and electricity went off. So we went to the hall, and then I saw the doctor. He went out of the hospital room and he looked desperate. He started to scream, "Somebody can give me the electricity because the child is dying on the surgical table." I didn't know like what happened after, because I moved to the shelter, but then doctors told me that the child died. IMC donated generator to assure that children will not die on the surgical tables. And there are like much more cases like this, and we are trying to respond. And every time we see something like this in need, we are trying to cover it, to help as much as we can.
Right. I mean, it's, for people that are not experiencing what's happening in Ukraine, you kind of forget that daily life goes on. I mean, babies are being born, people are breaking a leg, they still need help, and they still need, healthcare services. I mean, Matthew, maybe you could talk a little bit about some of the rehabilitation and the equipment and supplies that we've been able to deliver, and what it means. And the other interesting thing I think about our strategy is, strengthening health facilities in case they're under attack. Maybe you could talk a little bit about that too.
Yeah, sure. So there's sort of a two-pronged approach here to some of the support that we're trying to provide to literally hundreds of healthcare facilities across the country. The approach is a little bit different in some areas of the country. As Michelle touched on, there are still aggressions and volatilities in the western side of the country, but less so than that eastern front. So our approach is a little bit different along those lines. So some of the devastated healthcare facilities that we are supporting through material support, training support, in the western side, where things are a little bit more stabilized, some of the assistance we're able to provide is a little bit more permanent or semi-permanent. So installation of critical healthcare equipments, some rehabilitations, physical rehabilitations of healthcare facilities, just to get them back up to basic operationality and service provision. Then in some of the more volatile areas that are still subject to the aggressions that could result in significant structural damage or population displacement or utter devastation, we're looking at strengthening some of those facilities by way of bunkerization of critical, let's say, healthcare environments. So going a bit underground to strengthen walls and reinforcements and provide structural reinforcement so that maternity wards can function or surgeries can be performed. One of the other approaches that we're taking, there are certain portable modular healthcare facilities on wheels, for example. I mean, in Kharkiv, in the outskirts of Kharkiv, we're providing consultations for folks out of a mobile primary healthcare unit, primary healthcare unit on wheels,
like a big semi truck, right?
Truck with like a small hospital inside it. I mean, just incredible. So that we can go to, if the people can't come to us, then we will go to them to provide these healthcare services. So those types of approach, having to get a little bit creative, looking at strengthening some facilities that may still be subject to aggressions, and then reinforce and bringing certain facilities back up to speed on a basic level in some of the more stabilized areas. But it's a constant sort of, I mean, we're covering so much ground. We've had a lot of generous resourcing, but really, unfortunately, it is the task list in terms of bringing the healthcare infrastructure back up to speed. It's incredibly long. So
it gets longer every day. Yeah.
So it gets longer every day.
Right. Well, one of our listeners, is asking about International Medical Corps' role in compiling evidence of war crimes. As a humanitarian organization, we have certain principles that we have to adhere to. Matthew, maybe you could talk a little bit about that, and then, I guess sort of the closeness that exists among all of the actors in Ukraine, and the collaboration and the coordination that happens.
Yeah, so in terms of direct gathering of suspected evidence of war crimes, that is not something specifically that we're involved in. That said, we're sort of by proxy and by proximity, seeing that these efforts are underway, that there are, and especially in healthcare facilities, I mean, there are hundreds, if not thousands, of healthcare facilities that have been directly targeted by Russian aggression. And to the extent that
that's a violation of,
a direct violation of the
international law. Yeah.
And that, and those narratives are being collected visually. They're being collected through interviews with facility directors, healthcare management staff. I have personally seen blown out entire wards in hospitals, clinics, ambulatories, intensive care units, obviously targeted and destroyed. That said, I'm not participating in any formalized mechanisms by which we would capture or testify or provide testimony toward evidentiary gathering for in terms of making a case for war crimes. But that is certainly happening around us. And yes.
Right. And there's conversations happening at all levels. I mean, maybe you could talk a little bit about, there are a number of, groups that are working in Ukraine, and the government, of course, is leading the effort. Maybe you could talk a little bit about how we coordinate with local authorities and ensure that the work that we're doing is, centered around the affected populations and the priorities that they have, as opposed to what we want to do.
Yeah, sure. So that's the priority, right? And the way that we access these areas is hand in hand with local authorities. Our line ministries at national level, the Ministry of Health, the Ministry of Foreign Affairs, we have these relationships there, but in Ukraine, at oblast level, right, at state level, these relationships, in terms of determining where the most impactful service delivery based on the greatest need should be targeted. Those conversations are happening all the time at that sort of granular on the ground level through our field site coordinators, our humanitarian personnel working in all of the different program sectors that we cover. Those relationships are essential. And before we would make any sort of move, right, to provide services, we would do our diligence in terms of figuring out with local authorities and local actors, where are the needs, what needs to be done. We want to make sure we're addressing these in a meaningful way, right? So it's all about sort of that meaningful targeting of services to populations that are in distress. And most importantly, amongst those populations, the folks that are most vulnerable to risk and most at risk in terms of the circumstances that they're facing.
Right. We have one question from one of our listeners that asked about the mobile hospitals. I think everybody thinks that's really cool. Where do those come from? And then what are our plans for them? I mean, we would donate them to the ministry at some point.
Yeah, I mean, we're managing our mobile primary healthcare unit now. It's part of an arrangement that we made through a provider called Hospitainer, and they designed these modular and mobile healthcare units for deployment specifically for these types of areas, right? Mm-hmm. Hard to reach, war devastated, where people have limited access to healthcare service through normal means. Yes, and at the end of the line, right, when the war finally ends, and I assume that we assume now that this type of service delivery would still be needed for some time, and we would reach a point where we would donate that to local hospital managers or the Ministry of Health at local level, so they could continue to use that to provide services.
Yeah. Michelle, I mean, is there anything when you look at the coming year, is there anything that you would do differently, or what are your priorities for our mental health work?
I think a key priority, and Rebecca, you're already circling around it before, is our coordination with ministries and also the First Lady's office, especially around MHPSS. We have done that a lot in the past year, and we've really developed some strong connections. And I think in the coming year, we can really take that to the next level. You know, in November last year, Ukraine released a roadmap for mental health that really outlined what they would like to achieve in the next year, in the next 5 years, and then even 10 years on. And it's really wonderful when you're in a situation like this that's so volatile to see such strategic thinking about building back better and system strengthening. So I think in the coming year, a key priority for International Medical Corps in terms of mental health and psychosocial support will be really just continuing to cultivate those relationships and support that rollout. A key part of that roadmap is really these, capacity strengthening trainings that I was talking about, one of which trains primary healthcare doctors to identify persons who are exhibiting heightened signs of distress, so potential mental health conditions, and providing them with the basic skills that they need to support those persons and give them the care that they need. IMC in the past year has already trained a number of doctors across the country on this, and we hope to scale that up even more. And more importantly, we're creating doctors who can train others. So this really allows us to have a greater reach and really create something that's sustainable and will live on beyond our time here as well. So I think for the coming year, we hope to do more of those initiatives, not just on primary healthcare, but stress management strategies, really strengthening capacity in country.
Mm-hmm. Mm-hmm. I mean, we've had a couple of questions about potentially volunteering. And Matthew, I know for some of our training activities, we have used volunteers, but maybe, there is a lot of capacity in Ukraine. I mean, maybe you could help answer that question for our listeners.
So what I'm hearing is that there are a lot of, let's say, local level across the international community. So back in the States, in Europe, there are a lot of on-the-ground local organizations that are mobilizing to support Ukraine in all kinds of ways. I encourage those types of, efforts. This is wonderful that there's a groundswell of this type of support. In-country support, though, I encourage volunteers to be very circumspect and thoughtful about the decision-making. This is an incredibly volatile and it's a dangerous environment, and people should feel, really comfortable with the apparatus around them and confident in the management of any sort of mobilization into the country. There's a lot of work to be done, right? There's now an increasingly coordinated humanitarian response, a more standard sort of humanitarian response that we typically see with coordination mechanisms through the United Nations. A lot of major global humanitarian agencies are here. A lot of my colleagues from other missions are here. I cross paths with them every day. There's a lot of work to be done, a lot of receptivity to support from the Ukrainian government and local Ukrainian populations. So that I would, encourage people to sort of think that through and see what opportunities are available to them. There's a lot to be done. So.
And you can also inquire on our website. We have a way to volunteer for International Medical Corps, and then one of our colleagues will reach out to you. Natalia, I'll go back to you. I mean, is there anything that you want our supporters to know about what's happening in Ukraine? What's something that we should know that?
Yeah, when I traveled through all these places that were affected by war, I met hundreds of people and I heard hundreds of stories. Every single person here has a story, and every story is amazing, worth to be filmed on the Netflix movie. And I would say that every place you go, every person you talk to, you will find a way to help her and you will find a way to support them. So I don't know, I could share the stories, but
Why don't you share one with us, Natalia? Share one that was
I think I don't know. I think that everyone they've heard a lot about Ukraine, but one of the most recent is the story from the Izium District Hospital. Their building was partially destroyed, and we were among the first organizations that arrived there after this place was liberated. And we met the doctor in the hospital. He is orthopedic surgeon, and he was there during the whole period of occupation. He did the surgeries, all type of surgeries in the basement, using the very little equipment that they managed to save, having this small, tiny lamp above his head, and he did everything, and they had a lot of the injured people during that period of time. The city was shelled, they had these mine injuries. They have just a very simple stuff appendix removal or something. So he did everything. And, he lived in the hospital, and he showed us his scar. It was damaged with the shrapnel and a lot of the bullet marks on it, but he's still using that. He lives in the hospital because he has his house destroyed. But still, he's he's very encouraged to do his job and to rebuild the hospital, and he's doing all his best to involve more people in helping them. So I'm also encouraging you to be involved in that. And this doctor, he recently called me and he says, many people told me that they will never come back to this city again after everything that happened with them in that city. But now when they saw how many people, organizations, volunteers are there to help these people, they're starting to come back. They want to rebuild this city. So I think this is really inspiring. I hope that this doctor and his story will also inspire you.
Absolutely. Well, I mean, as we have about 5 minutes left before we wrap up. I mean, we sort of often end our briefing calls with this question. And I mean, I think, Natalia, you gave us one example, but Matthew, maybe you could talk, and Michelle, a little bit about what gives you hope. I mean, what motivates you to kind of get out of bed and do it all over again each day?
Yeah, thanks so much, Rebecca. So the now world famous Ukrainian resilience and toughness. I mean, we see this this sort of resilience in the Ukrainian people from the beginning of a war that was meant to last a relatively short period of time, and now here we are a year later. And as tragic as that is, the tragic effects of this war. Despite all of that, there's this incredible Ukrainian resilience and toughness. And at the same time, I want to mention, you all have seen this in Natalia here tonight. There's a certain good humor about the circumstances here. an incredibly inspiring and impressive good humor in some of the toughest circumstances you can imagine, right? And I think it's that good humor that has a touch of optimism mixed with this world famous toughness that the Ukrainians have exhibited that keeps me going for sure.
What about you, Michelle?
Yeah, I would say it's quite similar for me. I mean, I remember a particular week where there was a lot of shelling in Kyiv. We're spending a lot of time in the shelters, and it was really disrupting our activities. And a Ukrainian colleague of mine, I said to her, you know, how are you managing? Like, how are you coping with all of this? And she said to me, to be honest, it gives me hope because I feel like we're close. I think the reason why there's so much shelling is because they're getting nervous. And I thought it was just such an interesting way to look at it, which just shows how remarkably resilient the Ukrainian people are. And for me, you know, as much as we can support that, you know, that's what brings me to work every day.
Yeah. I mean, Natalia, do you have any final thoughts that you want to share with us?
Not really. I just wanted to say thank you, guys, because IMC not only saved my life, they also gave me the opportunity to work and to help my Ukrainian, my people. So thank you so much, and Slava Ukraini.
Well, and the truth is that for International Medical Corps, I mean, we couldn't do it without the support of our donors. So I just want to thank everyone on this call for your generous support. It really does make a difference. You can see from Matthew, Michelle, and Natalia that we're getting things done in this incredibly difficult environment, and we're going to stick with it. We're not going to give up, and we're going to keep going in 2023 and beyond. So just thank you so much for joining us today. Thank you for your support, and we look forward to seeing you on the next call. So thank you. Thanks, Matthew, Michelle, Natalia. Really appreciate it.